So what you kind of mentioned about few misconceptions,
Mhm,
very nicely about the misconceptions what people have about oral health.
mhm.
Um, what are the do you face any challenges from the patients coming in and explaining their stuff or anything like that? And what's the tricks that you use to make them comfortable or make yourself feel peaceful at work?
Well, I think what you have to do as a hygienist is you just got to educate your patients. It's always their choice on what they want, but it's our job to, educate the patient on their oral health. And, like, if your hygienist is not probing you whenever you come in, where they take a measurement and they like call out the numbers around your teeth, if that's not being done, then you should go to a different dentist. Because that's how we're going to be able to tell, the real health of your gums. And what we do is we walk a probe around, which is a measuring stick. We'll call it a measuring stick. And we walk that around the tooth, in the sulcus. And what we're checking is see, first off, does the tissue bleed? Because remember, bleeding's not normal,
Mm-hmm.
right? And how deep that pocket is. Because if it's a healthy pocket, right? Just like if you have healthy muscles, they're nice and tight, right? But when they get inflamed or they're infected, they get kind of loosey, right? They get looser or they flare up. So then, therefore, it's a deeper pocket. So because we're bleeding, we see the bleeding, and then we also see that the pocket depth is, 4 and above. And we used to not treat really perio back in the day. It was like 6 millimeters, and that was it. Anything under, and then it moved to 5, right? Now, the latest American Academy of Periodontology recommendations is at 4 millimeters, meaning that, if they're walking around and calling those numbers out, 4 and up, we should be treating in some type of periodontal therapy, be it gingivitis, which everybody has heard about gingivitis. So, gingivitis is the earliest stage of periodontal disease in which the gums are just bleeding, but there's no bone loss. Once you get into periodontal disease, then you have the start of bone loss, and that infection causes deterioration of the bone, and then it starts off mild, moderate, severe, kind of, right? That's the best way to kind of lay it out. Now, as clinicians, here's your thing about the medical model. We now stage and grade disease with the new guidelines that are now in dentistry compared to what we had previously, which that change didn't come about till 2019. And in 2019 is when we began to really stage and grade disease of the mouth. Before, we never did that. So that's what I mean. Like, dentistry's changing so much. And now it's like, oh, it is part of the rest of the body. We need to treat it the same way. And so you're starting to see those medical concepts in dentistry come about.
Got it.